All right, Dr. Rob, I am a new dentist. I'm out of school, been practicing for a little while. I'm ready to get my hands into implants. Where do I start? What do I do first?
I have a method. I have a method for everything, don't I? I have a method that I like to tell new dentists on how to approach their career. And the first thing is that most people that go to dental school are hard drivers, right?
Sure.
You don't get into dental school unless you have to go through a lot of hoops. You have to check a lot of boxes, okay? And so the people that are coming out, they want a good life for themselves and their family. And so they're hard chargers. And so the first thing I will tell you is that when you first get out, pull back on the reins, okay? Now this seems counterintuitive, but I tell people when you first get out, pull back on the reins, figure out the one thing that you want to master first, and then go after that, okay? Now, I wouldn't necessarily encourage people to start with implants. And here's why. Dental implants are multifaceted. Think about a multifunctional or a multidisciplinary group practice. They'll have an oral surgeon, they'll have a periodontist, they'll have a prosthodontist, they'll have a general practitioner, and they may even have a lab in that building.
Sure. Now,
that's perfectly set up to do implants because implants require all of those skill sets, and sometimes even ortho, okay? So what I say is, if you're going to start, maybe you don't start day one with, I want to go take all the implant classes, because there are building blocks that you would like to have in your toolbox before you go there. And the number one thing is oral surgery, right? So when we talk about removing teeth and not traumatizing the surrounding architecture, traumatic extractions, if there is anything such, but you have to be good at that. You have to be proficient. You have to get to the point where most teeth take about 10 to 15 seconds to take out. When you get to that point, you're golden, okay? Because your experience and your techniques are going to be so good that you can look at anterior teeth in the aesthetic zone and you know, I'm going to get on that with my favorite instrument, the ash forcep. I'm going to rotate that right out of the mouth in about 3 to 4 seconds, okay? And you're going to be really good at that. And you're not going to traumatize that thin buccal bone. Because if you break that buccal bone, it changes everything, okay? You can have a fenestration, you can have a poor wound healing. It's not good, right? So you need to leave it in place. How do you do that? Through rotational forces. You don't luxate, you rotate, okay? You put the interface between the tooth and the bone in shear, which we talk about with dental implants. Bone is weakest in shear. So you put it in shear by putting a rotational force on the remaining root structure. Rotate the tooth down, you get it out in a couple seconds. Now you've got a perfect place to place a dental implant for an immediate implant placement, okay? But you have to do that first. So getting really good at your extraction skills is number one. Number two, you have to manage pink, okay? So years ago, when we first got into dental implants as an industry, the objective was to get the implant to stick in the bone, right? Like it was really caveman-like. If I can just get this titanium to stick in the bone, I'm going to check the box that says that was a win, and I'm going to push all the complications downstream to the pros. Okay,
Not my job.
Not my job. I'm pushing it downstream. Now it's going to the pros. Okay, and then we got these crazy artifacts that are floating around, and we see pictures that come into hygiene and stuff. You're like, oh, look at that interesting solution, because that's the way we used to do it. Well, today we don't do that, right? Today we're looking for a tooth replacement therapy that is invisible, that you can't see, that you don't remember. It's been a couple years since you saw the patient. They show up for hygiene. You go, I remember we did an implant on them, but let me see if I can find it. And you can't find it yourself. Now that's a win. And you cannot accomplish that without good soft tissue management. You have to be able to manage the soft tissue. So what do? You start taking soft tissue courses and you get good at grafting. You're gonna need your basic connective tissue grafts, your basic free gingival grafts, your basic tunneling techniques. If you get good at those things, now you can manipulate the white bone, you can manipulate the pink soft tissue, and you're in a pretty good spot to go into dental implants. But yet there's one last thing. You do need to understand aesthetics. So you need to understand the pros part of it, because otherwise you'll be putting, corn pops on a stick, it'll look terrible, right? So you do need to understand the aesthetics. So taking some aesthetics courses and learning what to look for in terms of cosmetics and aesthetics so that it becomes harmonious with the mouth, so that it blends in indistinguishably. That's what you want to be able to do. So you get those three things. Now, learning dental implants becomes rather easy, because if you come to the Implants Made Simple method, it's implants made simple, okay? If you have those building blocks, all you need is a little bit of glue knowledge to tie those together, and you'll have just spectacular, amazing, low risk, incredibly long lasting aesthetic solutions. And that's what we all want to give to our patients. Now, on a big level, the way I suggest you do it is when you pick the topic that you want to learn first, commit all of your resources to that one topic. And the reason is if you go to a course, even a 2-day weekend course, you go to a 2-day weekend course and you come back, if you don't get started right away, if you don't start to put it into practice right away and sign up some cases and get going, you are going to lose a lot of the knowledge that was presented in the class, and you'll miss out on the knowledge that you received. You're going to forget it. So you want to start right away, and you want to go hard as you can for about 6 months. All right? Something happens after doing something multiple times over 6 months, but by the time you get to 6 months of doing something over and over again, you start to be very competent. And when I mean competent, what I mean by this is you don't have to open a notebook that says, how do I do that root canal again? What was the working length file you don't do that. You just go, boom, I'm going in. I know exactly how to do this. You're not even thinking. It's when you get to the point where you're doing a procedure on autopilot, then you're done. You have mastered that topic, okay? Then move on to the next subject matter. So start with one of those three things, master it, and then move on to the next. If you attempt to do them all at the same time, it's possible that you can do that, but you better not be married. You better not have children. You better not want to try to improve your golf game. Don't think about hunting. It would be really hard. So we talk a lot, Dr. Bobby talks a lot about life-work balance, and 6 months is nothing in the overall career for a new dentist coming out, getting started in dentistry. 6 months to get really good at something is nothing. So pace yourself and go from there. And surely the next question is, well, where do you get this kind of education? Well, I always go straight to the top. All right? I always go straight to the top. So if you said to me, hey, I need a good soft tissue course, I immediately say Pat Allen, Texas, period. Start there. And you go there, you take his first course, 2-day course, you take his second course. After you've mastered that, another 2-day course, say 3, 4, 6 months later, and implement it, and you'll be good to go. So that's how I say, always go to the best educator in those different respective fields that you can find and get the best knowledge you can possibly get.
How do you identify that best educator in each of those fields?
The best way to do that is to find a mentor, okay? There really is no other way. Find someone that you trust. Find someone who has impeccable character, that has all the right motivations for you as a young dentist and your patients, okay? When you find that person, you'll know who they are, and ask them, where do I need to go to learn about extractions? Where do I need to go to learn about pros? And they'll tell you, and then go research it a little bit, but then go to those people and learn from the best.
And when you're looking for that mentor, are you also considering their body of work, their portfolio, and looking at, if they're good?
Yeah, I would say that it would be difficult to look to someone who is not a doer as a mentor. In other words, if they say, I've heard that John Kois is good, okay, is different than I took all of his courses in 6 months. I took them all in 6 months because I had to have them that fast because they're that good. Then you go, okay, now John's good, and you're implementing it. Okay, so you're doing you're doing what you learned, and you're practicing, you've been doing it for a while, and it's successful. That's what you're looking for in a mentor.
Absolutely. I think that's a good method for getting started.
And if anyone has any questions, feel free to reach out to me and I'll point you in the directions that I'm aware of. This has been another episode of Implants Made Simple. I'm Dr. Robert Stanley, Smile Engineer, out.